Dr. Sheth, to bring you in on this, the parents across the country right now, Dr. Sheth, are panicking because, while it is true that children have either not been infected very much or have mostly been asymptomatic, there is this sense that with this scary third wave coming, we don't really understand much about what's going to happen then. Parents don't want to take a chance. They're wondering when vaccines are going to become available. These guidelines have come now from the government. How are you advising parents who come to you with those concerns, ma'am?
So basically what we need to understand is that the virus is not going to fly to the children. So there has to be a cross infection.
Yeah.
So either the parents bring the infection at home or children attend any kind of the gatherings with other children or other functions where they are going to get infected. So what we have to actually keep emphasizing to everyone is that the COVID measures are very important. Vaccines are certainly going to come. Government is acting very proactively. Every state government is acting very proactively to keep training the people to the grassroots level in the best possible way. Multiple workshops every day, at least in Maharashtra, are happening to keep training so many pediatricians and the paramedics to have some kind of the standardization of the care and
yes.
cohorting and isolations and referral strategies, and each one of us are putting some efforts to contribute to those guidelines and to contribute to those training. But at the same time, it is the responsibility of the parents to continue to maintain the COVID measures themselves.
Yes.
And keep telling the children that till the vaccine comes, at least children need to maintain the COVID measures. And at the same time, it is also being seen that children are really depressed because of the lockdowns, lack of the physical exercise, lack of the physical schooling. So what normally I talk to children and I tell them and keep telling the parents also that it is okay to play. What we have to tell the children that when they play, they run fast, they feel breathless, and if they want to put their guard down or want to have a water break, they need to be in the corner maybe 6-10 meters away to have a water break.
Yes.
But apart from that, we have to continue COVID measures because our all frustrations are around masks until we get enough vaccinations on board.
Yes.
And understand that they are protective enough. We need to continue to wear the mask. So
yes.
This is where we are. We cannot be locked forever because I think lockdown is more scarier than actually dying itself. But at the same time, resources also have to be allocated in a right way to right people. So no need to be panic and continue to do COVID measures and keep in touch with your pediatricians. And as Dr. Anita has said, we are very conservative in using steroids in children. We are very conservative
yes.
of using remdesivir in children. Judicious use and allotment of the resources at the right time to right indicated children will be very necessary step in the next 6 months. The third wave is a possibility. It has not happened. The real tiger has not come. But the good part is, we are learning from other countries. We are learning from, these clusters of the outbreaks in children. And if you really look at them, even if, in Ahmednagar or in other pockets, too many children are infected, but number of the children dying because of the COVID, those numbers are far lesser compared to the adults.
Absolutely.
And that is itself is reassuring. But at the same time, it is better to have no COVID at all till we get the vaccine.
No, very true. I agree with you. I agree with you, Doctor, especially in the fact that, the lockdown can't be non-stop and uninterrupted. There has to be an end to it because the world needs to move on. Dr.